Every outbreak begins quietly. A fever, a cough, a mosquito bite, a virus crossing a border. Long before the world reacts, scientists begin searching for answers. For 46 years, one institution has stood at the center of that mission in Kenya, the Kenya Medical Research Institute, Kemri. From malaria to HIV, from tuberculosis to COVID-19, from outbreak surveillance to vaccine research, Kemri has helped Kenya confront some of the world's greatest health challenges. Now, the institution enters a new chapter, not only as a research powerhouse, but as a chartered institution empowered to train the next generation of scientists through its own postgraduate and PhD programs. Established in 1979 to conduct human health research in Kenya, over the decades, it has grown into one of Africa's leading biomedical research institutions. Its scientists now work across infectious diseases, genomics, vaccine development, biotechnology, outbreak surveillance, mental health, nutrition, and climate-linked health threats. But Kemri's work is not confined to laboratories. Its research increasingly shapes national policy, public health systems, and global scientific understanding.
Kemri is a global institution. The work that Kemri does in research is felt globally. In the areas of malaria, the work which Kemri has done has been translated into practice. Talk about the issues of birth nets that is being used currently all over the world. Work on birth nets was done in Kemri. The regimens of drugs that are being used currently for HIV/AIDS actually was partly formulated here in Kemri. The right regimen that is being used. When we call the issues of neglected tropical diseases, there's this thing called National School Deworming Program to prevent things like schistosomiasis, intestinal worms. Kemri is the only perfected that, but it's now used globally.
The main mandate of Kemri is health, a better health for all Kenyans. Also issue of capacity building and training, collaboration with partners within and without, that is within Kenya and internationally, and also to give policy briefs to the Ministry of Health whenever issues arise. Presently, Kemri does a lot of research and it has several centers all over the country, from literally all parts of the country, mainly Nairobi, Kisumu, Kilifi, in Coast, several in Coast, Kilifi, Kwale, Busia, Kericho, Eldoret, Kirinyaga, Mandera.
And Kemri, Your Excellency, if you go today, you'll find the best, the latest polio labs in our region. In Kemri, we have the highest level of biosecurity labs in our region. In Kemri, Your Excellency, is where through JICA, through working with WHO, through working with Africa CDC, through working with Walter Reed and US CDC, have become one of the best regional hubs in terms of innovation, diagnostics, therapeutics, and vaccines production.
Then came COVID-19, a pandemic that overwhelmed health systems, disrupted economies, and exposed the fragility of global preparedness. In Kenya, Kemri became one of the country's frontline scientific defenses. Its laboratories expanded testing, scientists tracked the virus, researchers supported surveillance systems and informed government response strategies.
We'll be looking at non-communicable diseases. We'll be looking at the other sort of pandemics like the ones that we just had the other day, that Kemri is really going to look at the societal issues so that whatever research is being done, it is something that is addressing the societal challenges. So malaria, HIV and AIDS, pandemics, and other public health sort of threats.
For years, Kemri trained researchers who graduated through partnerships with local and international universities. But Kenya's scientific ambitions were outgrowing that model. Now, with the award of a charter to Kemri by His Excellency President Dr. William Ruto, joins a select group of specialized degree awarding institutions in Kenya. The milestones signal more than academic recognition. It represents a strategic investment in scientific independence, advanced research training, and national capacity building.
I, William Samoei Ruto, President and Commander-in-Chief of the Defense Forces of the Republic of Kenya, hereby award the charters annexed hereto to the Kenya Advanced Institute of Science and Technology and to the Kenya Medical Research Institute.
The charter now enables Kemri to directly offer postgraduate and PhD programs in specialized health research disciplines. For Kenya, this means retaining talent, strengthening research capacity, and building the next generation of African scientists with African institutions.
KAIST and Kemri represent a new generation of public qualitative graduate universities with highly specialized mandates. The academic structure of these two institutions are deliberately focused on training and advanced research in fields that are critical to Kenya's future competitiveness.
Kemri's charter is a landmark achievement for Kenya's health sector and for the future of public health in our country because it signifies national confidence in Kemri's decades of excellence in research, innovation, and scientific leadership.
For us, this charter fills a significant gap of how then do you move from just generating evidence through research to utilizing it to impart the next generation of professionals and academics.
We'll still remain our core mandate being a human health research institute. We still remain a research institute, but being able to confer these advanced degrees through the research we do. So we applied through that clause, and what we had to put in place now was the adequate infrastructure for us now to fulfill the requirements of the university regulations, the right workforce who will be able to train these fellows, the right curriculum which will support these trainings to be in place, and also most importantly, that partnership with our local and international partners who we can be able now to, even now as we train, expose these students to the industry, to external supervisors, external mentors, for them now to be all-rounded.
I would like to really congratulate them for that and urge that they remain focused on this very specialized area that they have chosen, but become excellent in it. Then I would like to see that Kemri becomes the institution of choice for students in Kenya, in the region, and even globally. There is no reason why global students cannot come to study at an institution in Kenya. We are good enough.
We had a program with the Jomo Kenyatta University, formerly called ITROMIT. We have graduated more than 2,000 students, both masters and PhDs. We have another program called IDERO, which is based in Kilifi, which is funded by Wellcome Trust. We have graduated more than also 500 masters, PhDs, and postdocs. So we have been doing this training. However, we have not been completing this training because we have not been able to award the degrees. The charter has allowed us to complete the process, whereby we admit, we train, and we graduate them.
The benefit for Kemri is that when we have research projects, we actually can now embed university students very comfortably, and the students over and above achieving their
degree status, they'll also support the institute by channeling out both in terms of data. We'll have more data that is actually available for decision making at different levels. And it may be that some of the students actually will be human resource for the institute, because after we train them, we also will have capacity to actually absorb them based on that.
It is growth in terms of positioning the institution, making a greater contribution to the needs of this country. Because training, building capacity for the future needs, it is indeed what is going to position this country to be able to deliver and produce its own therapeutic products, and also the products that are going to be able to meet the needs of the people from a health sector.
Kemri is also supporting Kenya's ambition to strengthen local manufacturing capacity for diagnostics, vaccines and health technologies. The goal is clear: to reduce dependence on imported solutions during future health emergencies. Researchers are also contributing to the global effort to shorten vaccine and diagnostic development timelines during future outbreaks. Some of Kemri's greatest contributions are not always visible. Research that informed vaccine policy, data that guided outbreak response, evidence that shaped national healthcare decisions. From rotavirus studies to HPV vaccine research, Kemri science increasingly influences healthcare policy in Kenya and beyond. The next health emergency may not look like the last one. Climate change, antimicrobial resistance, emerging viruses, future pandemics, the threats are evolving. So must the science.
Research, or funding for research, is a global thing. Researchers in Kenya, researchers in the US, researchers in Japan, researchers in Europe, always work together as a network. Because a problem that may occur in Africa, tomorrow will be in New York. Tomorrow, let's say an Ebola pathogen that occurs in the Congo or in Nairobi, next day it will be in Tokyo. So we are all cognizant as international researchers or international networks that we have to work together.
Kemri researchers have equally contributed globally recognized work in malaria, HIV, tuberculosis, maternal health, and epidemic response. This institution has also played an important role in the development and evaluation of the malaria vaccine, now protecting children across high-burden regions. This is the impact we are determined to accelerate and scale up by making Kemri a specialized degree-awarding institution.
Kemri scientists are strengthening surveillance systems, studying emerging pathogens, monitoring antimicrobial resistance, and expanding One Health research linking human, animal, and environmental health.
We suffer some unique illnesses and diseases locally that are unique to us. So those uniqueness requires local solutions. So we really need to empower our people to be innovative and to do research that is locally targeting our local problems. I'm actually a product of Kemri Graduate School at my PhD level. And one thing that Kemri exposes the scientists to, as opposed to some of the institutions within this region, is the interconnectivity between Kemri and international institutions.
For more than 4 decades, Kemri has helped Kenya confront disease, strengthen science, and protect public health. Now, with a charter to train its own postgraduate scholars and researchers, the institution enters a new era. One Kenya is not only responding to global health challenges, but helping lead the search for solutions. Because the future of healthcare will belong to nations that can generate knowledge, train talent, and innovate for themselves.
We have given a priority to research and innovation, which is our core business. Looking at the new innovations coming through, the new research fronts that we are opening, the new partnerships that we are opening, this will significantly boost the position of the Institute as a world leader in human health research.
Our commitment as a team is to continue to position this organization to be truly African, truly global, and yet providing solution to African problems.
The future is bright for Kemri because we will be able to shape the capacity that the country needs. We know the gaps in terms of skills and knowledge, and we will be able to contribute to that.
And for Kenya, that future is already taking shape inside the laboratories of Kemri.